My name is Anouk. I'm a student at IOB Osteopathic Institute. I'm on my 5th and final year. We are practically practitioners now, and this is a huge responsibility. We can heal people and improve their quality of life by resolving many structural or physiological troubles. That is why I chose osteopathy. At the clinic, we see patients almost every day with various pathologies and history. I think that's the best learning we can get.
Good afternoon. I'm Dr. Vincent Staff, CEO and founder of IOB, International French Osteopathic Medical School. Today, we are presenting an osteopathic treatment for babies newly born with asymmetry of the skull. These kind of problems may cause many pathologies during the early childhood. Many babies leave the maternity without the control of skull bones by an osteopath. The repercussions are highly variable and affect all systems. The most important for us in osteopathy is to prevent the overlap of sutures developed by the pressure of the skull during the birth and during the growth in utero. The bones overlaps cause a fixation of bone plates at different locations, and the consequences with the time is the development of asymmetry, plagiocephaly, and brachycephaly. The baby that we receive today with our students is 4 months old and presents a plagiocephaly on the right side of the skull. As you can see, we have to treat the coronal, lambdoidal, and temporal sutures, who presents overlaps on certain parts of the bones. It is mostly important to understand that those mechanical parameters are not only an aesthetic problem, and also that the deformation is not consecutive to the positioning of the child in its cradle, like we heard in a lot of studies. The consequences of the deformation are first postural. When the baby starts its verticality, the upper cervical spine will compensate for the obliquity of the occipital bone. After a few months, when the baby starts to walk, the entire spine will compensate and the scoliotic attitudes will appear in the early childhood and the years after. Other important consequences are locales inside of the skull. Bones overlaps reduce the cranial movements and the circulation of intracranial fluids. Consequences are sleep and behavior disorders, rhinopharyngeal and throat infections, loss of hearing, head aches, delay of dental thrust, and a lot of pediatric pathologies during the early childhood and for all the life of the patient. You can see one of our students of 5th year studying in IOB making the pediatric school treatment with the control of an experienced professor. We receive many babies every day in our IOB educational clinic. The osteopathic pediatric treatment is now a major health issue for the babies all over the world. IOB International Osteopathic Medical School is ready to train international students to develop this medicine in the UA and in a lot of countries for the coming years. Thank you for your attention.